about what is pterygoid implants.
Yeah, definitely. So see, the one of the USP of basal implantology or the single piece implantology, strategic implantology, fixed teeth in 3 days, single piece implant. So these are all different terminologies of the same science basically. One of the biggest challenges most dentists have is handling the resorb posterior jaw. So in the maxilla, the sinus gets pneumatized, and in the mandible, the inferior alveolar nerve is unfavorably placed. So a lot of times then you have to either do a all-on-4 or have a cantilever prosthesis, or you may have to do a procedure of extensive bone augmentation. But if you are placing a pterygoid implant, which is a distal anchorage point in the maxilla behind the sinus, you no longer have to do cantilever design or bone grafts. Similarly, in the mandible, when we say bypass the nerve, in simple language, we are placing the implant in close approximation to the nerve, bypassing it in a way without causing any injury. So we are not injuring the nerve, but yet placing the implants using the buccal engagement technique or the lingual engagement technique, wherein we create a distal anchor points even in the mandible. And with all these things, we are able to give a non-cantilevered prosthesis to the patient in immediate load protocol without any bone graft procedures.
Great. So bone graft and all that complicated procedures are not at all required.
Not at all required. Almost, I would say they are redundant. If I may say, they are outdated. Some special cases for maybe just blowing up the zenith or something cosmetically, you may think about, but functionality point of view, implant placement point of view, addition of bone is definitely not something you require for implant placement.
Okay.